Welcome, everyone. Today we are here with Dr. Bachman from the Women's Health Institute at Robert Wood Johnson Medical School. Dr. Bachman, would you mind just telling us a little bit about yourself and your time here at the WHI?
I'm very fortunate to be the director of the Women's Health Institute at Rutgers Robert Wood Johnson Medical School, and as such, I get to actually interface with phenomenal students and residents and fellows, attendings, and women who are not only my patients but colleagues, friends, and advisors. And one of the issues that comes up that I'd like to address today is the issue of our transitions from the reproductive stages of life to the menopausal stages of our life.
That's very interesting that you bring that up because there are many resources out there for people to understand these things, but with an overwhelming amount, it can get pretty hard to understand what questions to ask, who to talk to, and what it is to understand in order to move forward with our health and taking care of ourselves. Now, today I'd like to talk about the comorbidities of menopause and any kind of complications that can come ahead during this life stage.
Well, let me first preface menopause by saying that it's really not one point in time, and that we as women transition throughout our entire life cycle through hormonal cyclicity, where we are having a menstrual period every month, to a period where our periods may become, our menses may become very irregular to the point where we no longer have periods. And that entire transition, women can have symptoms of menopause despite the fact that they may be getting periods. So menopause is not necessarily having no periods, but rather the transition where women may start to feel hot flushes, night sweats, they may notice some increased vaginal dryness, and if they're attempting to get pregnant during that time, they may have more difficulty in getting pregnant. So my point is, it's not one point in time where you have a last menses, but rather it is a transition, and all women go through it over different time periods. For some women, it's 1 year. For other women, it can be up to 10 years. So during this period of time, it's really important for every woman to monitor not only her menstrual cyclicity, but if there are any other changes in how she feels, her mood, her sleeping, her temperature control, even basically her ovulation, to see if she's ovulating or not ovulating during this period of time.
So it's very important for women to be in touch with their own health and their own bodies at this point in time.
Absolutely. And I think the most important point for every woman to remember is that it is a totally natural process. So despite the fact that it can cause women many, many discomforts, such as starting to have a hot flush in the middle of an event that they're sponsoring, or during a speaking engagement, or even at home while they're watching a show on TV, that it's a natural process. So what is happening? What's happening is that our hormones during this period of time are actually not as cyclic as they had been as the number of egg cells decrease. So it's really a roller coaster during this time period, and that's what causes all of the symptoms that a woman may have. And the most obvious ones are ones we've already referred to: the hot flushes, the night sweats, and the vaginal dryness, which can lead to some type of a sexual discomfort for the woman, be it either penetrative one or even any kind of contact in that area of her body. But it's important to remember that it's not necessarily a decrease, but it's actually the ups and downs in hormone levels that cause all the problems. Once a woman goes through the entire transition and her hormone levels are then consistently lower than they were during the reproductive years, is usually when all of the symptoms pretty much resolve, except for some of the vaginal dryness issues that many women continue to have into their 70s, 80s, 90s, even 100s.
And what are some ways that women can deal with the vaginal dryness and cope with it in ways that it won't decrease their quality of life?
Mm-hmm. Well, that's an important question because there's a range of ways that women can handle vaginal dryness. And the most important one to remember is there are many products that are available over the counter that women can experiment with. And it's like cereals. There's lots of cereals on the shelf, and one cereal you may like and others you may not like. And that's true with over the counter moisturizers and lubricants. So make sure that you try a range of them before you give up on them. I think another important point to remember is that some over the counter products that are not in the pharmacy but in the supermarket are also very good. Many women are using coconut oil, they're using olive oil. Any of the oils are also very good because they're natural lubricants, and a woman is not really committing herself to a prescription medication. However, if all else is not really doing the trick for the woman and she's still continuing to have problems, hormonal therapy with estrogen is very effective for so many women. And there are a lot of other options that are available today too by prescription, but that is the standard that we often prescribe to women who are having estrogen deficiency that's causing the vaginal dryness.
And how important do you think it is for women to understand that the symptoms of menopause are all within a range, and every woman experiences things very differently, and every woman has to be in touch with all these symptoms in order to understand how to treat them?
Mm-hmm. And I think that's really the key, that every woman is very individual. And so I can't say because my symptoms are horrific that another woman will have the same, or vice versa. If I don't have any symptoms, to say that every woman should have no symptoms, that they really are very variable. And the key to what causes really great distress is women who have very large fluctuations in hormone levels. That means that if the levels are going very, very high and then very, very low, it's during the peak downward that women will have severe symptoms. Many women can't sleep during this time period because of the night sweats that occur. So it is an individual menopausal experience for each woman, and you cannot say, I'm going to have the same menopause as my mom or the same menopause as my sister or my neighbor, because it really depends on how your ovaries react to the changes that are occurring in your body. But the more important point is that if natural remedies do not work, there are many long-standing remedies that do work, such as the estrogens, and there's many newer remedies that are out there today, and that's why it's really important to talk to your doctor. And I think one of the benefits of our Women's Health Institute is our ability to look at many of the clinical trials, bring them into the Women's Health Institute, actually be participants in clinical trials or lead in clinical trials to really offer women more opportunities, more interventions for menopausal symptoms.
That's absolutely wonderful because you're putting these tools into work within your own patients and your own clients.
Exactly. And I think that's really one of what I'm most proud of at the Women's Health Institute is that we are on the cutting edge of enhancing women's health in all aspects, including the menopause, and giving women other options for taking care of any kind of symptom, problem, illness, discomfort they may have, and also telling them if they're totally healthy and totally fine, all they need are preventive measures, such as making sure that they're not becoming osteoporotic with a bone density, that they should be asking their doctors to order every 2 years once they're 65, unless they have other problems. Their mammograms, their colonoscopies, pap tests with HPV, all the other preventive healthcare measures that women should be participating in with their healthcare provider.
Well, thank you so much for your time, Dr. Bachman. You've given us an invaluable amount of information, and we thank you for all your help.
And it's a pleasure talking with you.